Good morning, everyone. Just over 1 week ago, our great province moved to Step 2 of the roadmap to reopen, allowing the people of Ontario to take part in many of the activities they haven't been able to enjoy for some time. This is thanks to the hard work of Ontarians and the continuing success of the province's vaccine rollout. More than half of all adults in Ontario have received a second dose of a COVID-19 vaccine. Thanks to our incredible healthcare workers, over 16 million doses of the vaccine have been administered to date. And with all individuals age 12 and older now able to receive their second dose ahead of schedule, we will only continue to see these numbers increase. This is exciting news, but we are not stopping there. We want to ensure that even more Ontarians can benefit from the protection of a two-dose summer. Our government is working closely with public health units, community organizations, and other stakeholders to address barriers to vaccination. This includes targeted strategies such as mobile clinics, dedicated clinic days for youth, and town hall meetings in multiple languages. COVID-19 vaccines are safe and effective, and they are our best defense against this virus. As Dr. Moore said earlier this week, vaccines are our ticket out of the pandemic. And that is why, as we prepare to enter Step 3 in our roadmap to reopen, it is critical that we all get vaccinated as soon as possible. I encourage all eligible Ontarians to book your appointments to protect yourself and your loved ones. By getting fully vaccinated, we can help to put the pandemic behind us. Thank you, and I'd now like to hand it over to Solicitor General Jones.
Thank you, Minister Elliott. It is great news to be able to report again this week that Ontario's COVID-19 vaccination program is moving ahead of schedule. From day one, we promised to vaccinate eligible people in every corner of Ontario as efficiently and effectively as possible based on vaccine availability. And with a steady stream of doses entering the province, our extensive network of healthcare professionals have been and are continuing to help us keep that promise. As mentioned by Minister Elliott, the province has reached another milestone in our path towards a two-dose summer, with more than half of all adults in Ontario having received a second dose of a COVID-19 vaccine. And this level of protection continues to grow each and every day. We are also continuing our efforts to protect hotspot communities with Delta variant transmission through targeted supports, which includes the deployment of community and workplace vaccine clinics, as well as pop-up teams. Over a period of 3 weeks, these hotspot areas received an additional 772,000 vaccine doses, which allowed them to quickly vaccinate their communities and limit the spread of the Delta variant. The overall reduction of COVID-19 cases across the province is proof that vaccines are our best defense against this virus. And many of the cases we are currently seeing are from people not yet vaccinated. Between May 15th and June 12th, 83% of confirmed COVID-19 cases in Ontario were unvaccinated individuals, which shows how important it is to get a vaccine and get protected. If you haven't booked your vaccine appointment yet, please make one. It's quick and easy. We'll do so much to reduce the transmission of COVID-19, safeguard our healthcare capacity, prevent loved ones from getting sick, and ultimately saving lives. Thank you. Stay safe.
We'll go to the phone lines for questions. As a reminder, it's one question and one follow-up. First question, please.
First question from Randy Rath at CHCH-TV. Please go ahead.
Hi, Ministers. I'm wondering about the border. There's been a large number of calls from industry people and local politicians to open the border and get the economies in border areas really fired up. But yesterday, Dr. Hergy, the Chief Medical Officer of Health in Niagara, said that there's no way the border should open before the fall, that it should be shut until the end of August, and then we should reconsider. He's saying that this is mainly because of the rise of the Delta variant in the United States. Do you agree with Dr. Hergy?
Thank you. You know, Minister Elliott and I and our government have been continuously communicating with the federal government and reminding them through conversations, through letters, that the variants are coming into Ontario through our borders. So yes, we are concerned about it. We understand the importance of making sure that essential business and travel continue, but there is a responsibility at the federal level to make sure that as that movement occurs, there is also the protection in place to ensure that the individuals who are moving back and forth are properly quarantining, properly being monitored by the federal government, because we don't want to see additional variants coming into Ontario.
Follow up?
Would you encourage your government to give additional help to tourism industries that say that if they miss another entire summer, they could very well go bankrupt?
You know, the desire to open up Ontario and to allow as much business activity as possible has to be balanced with how the variants of concern are moving through our communities. We saw in areas like Porcupine, like Waterloo, that had historically not had any serious issues immediately spike up as a result of the Delta variant. We know it transmits very quickly, and we see those outbreaks very quickly. So yes, I understand that there is a strong desire to have the communities and the businesses open up as soon as possible, but we have to balance that with what we're seeing in terms of variants of concern, the Delta variant right now, and make sure that we have both in place to protect our communities as well as our business. And in terms of ongoing conversations with tourism operators, those conversations continue to take place with Minister MacLeod and her stakeholders and at the cabinet and caucus tables, and we will make sure that what we can do, we do quickly, and we share that information with the businesses as soon as we can. Thank you.
Next question.
Next question from John McGrath at TVO. Please go ahead.
Good morning. You know, the public health officer, the chief medical officer, Dr. Moore, has issued his call for arms. We're hearing more this morning about efforts to get more people to get their first doses. The province hasn't done what other provinces have done in terms of things like a vaccine lottery or other financial incentives to get people to sign up for their first dose. And we also don't have the framework for a disincentives to stay unvaccinated. Like we don't have rigorous sort of forgery-proof vaccine IDs. So, for example, you know, when theaters reopen, it's not clear that businesses could exclude people based on their vaccination status. I mean, have these gaps in our framework dropped the ball, for lack of a better word?
No, I think we've had quite a vigorous framework from the outset, and I think as Minister Jones indicated, the fact that 83% of the people during a certain time frame that ended up in hospital with COVID were not vaccinated, I think is incentive enough for people to move forward, to protect yourself, to protect your loved ones. And so we are going to continue with our efforts to make sure that we reach every person in Ontario who wants to receive a vaccine. And we are working with our public health units, with primary care as well, in making sure that we can do things such as the pop-up clinics in areas that may have higher levels of COVID, to make sure that we can have the clinics where we can have multiple translation efforts done into many languages, just to remove any barriers that may exist that are preventing people from receiving a vaccine that we can deal with. And so we are going to continue our efforts, even though we have 50% of the adult population vaccinated with 2 doses. There still is more work to do, and we're going to continue that work with our health sector partners.
Follow up.
Just for to sort of be absolutely clear, the government isn't reconsidering its position on financial incentives or any kind of sort of domestic vaccine passport in the near future.
No, that's not something that we're working on. We have put a number of financial incentives forward for businesses and so on, but the whole idea of a vaccine passport idea, that is a matter for federal jurisdiction. That is something that they will need to decide upon for travel and other purposes. What our goal right now is getting as many people vaccinated as possible.
Next question.
Next question from Lorenda Radikoff at CBC News. Please go ahead.
Hi there. Why haven't you made more use of family doctors with the vaccinations?
Thank you for the question. Actually, family doctors have been very important since the beginning of our vaccination program. They have been really vital in helping us to reach people that may have immunocompromised systems. They may have other health reasons why they need to be in consultation with their physician before they move forward with a vaccination. They will continue to be even more important as we get to a more steady state when we have everyone in Ontario who wants to receive a vaccine receive one, because there will be other people reaching an age when they can receive the vaccine. We are depending on our family doctors and our public health units in order to do that, because we know at some point our hospitals will need to go back to their usual businesses, that some of the places where we have the mass vaccination clinics now, which are in arenas and so on in municipalities, they will need to use them again as arenas, because we want people to be physically active as much as possible. So while physicians have been important throughout in the vaccination program, both in terms of their offices and in the mass vaccination clinics, they will continue to be even more important as we reach a steady state going forward.
Follow-up.
Looking at the percent of young people who've had their first dose, we heard from Dr. Davila in Toronto yesterday that there, 18 to 24-year-olds, almost 90% have had dose one, but overall the province, it's at 67% for 18 to 29-year-olds. What do you attribute this huge difference between, where you are in the province, where you live? What's happening, and are there certain parts of the province where you're going to have a hard time convincing people to get vaccinated?
Well, we know that the take-up of the vaccine has been better. The older you are, the more people have been vaccinated. Some of the younger people are not coming out in those greater numbers just yet, but we anticipate that they will. And we are doing things like working with social influencers, having situations and places where they can go where it's very easy and very convenient. And so we are not going to stop. We want to make sure that everyone who can be vaccinated and wishes to be vaccinated is vaccinated. So the pop-up clinics are very popular. Going to where people are instead of expecting them to come to us is something else that we are working on, and working with social influencers as well over social media.
Next question.
Next question from Brian Lilly at the Toronto Sun. Please go ahead.
Good morning. I'm starting to feel like you may be shifting the goalposts again. We've already heard from doctors. Dr. Moore is talking about kids in school needing to be masked in the fall. Dr. Davila yesterday was saying that Toronto bylaws restricting business capacity and more should be in place until October. The public has done their part, and it seems like you and the public health doctors are moving the goalpost on when we can get back to a better sense of normal. Are you moving the goalpost in terms of when we can start that process?
No, we're not moving the goalposts. They've always been very clear. It is a three-step process, and we are continuing to follow those steps. It is a combination of factors, as you know, Brian, and the number of people being vaccinated, of course, with first and second doses is very important. But there are many other metrics that we are applying and have always applied to determine whether we can move from one stage to another. And that also includes the number of people in hospital, the number of people in intensive care, the R factor. All of those factors come into play. And so that is something that we've been clear about since the beginning and that we are continuing to follow. We are not changing the goalposts because you're absolutely right. The people of Ontario have done their job. They've turned out for their vaccinations. Our healthcare workforce has done an incredible job having made sure that over 50% of our adult population has received both doses to date. So we want to be able to open up Ontario more as soon as it is safe to do so. We still have to be cognizant of the Delta variant and any other variants of concern that may make their way to Ontario, but we're following that very closely. And we want to make sure that we can move forward as soon as we can, but it has to be as safely and healthily as we can.
Follow up?
You've both raised the Delta variant, and I'd like to ask you about that. The Delta variant has seen a huge spike in cases in the UK, but it has not had a corresponding spike in hospitalizations. Their case counts have been going up exponentially for weeks, close to 2 months now. And in that time, the hospitalizations have not gone up at nearly the same trajectory. So obviously vaccines are working. When you consider that the over 70 crowd is more than 3/4 fully vaccinated and that they were the people most at risk from hospitalization and from death from COVID-19, can't you just say that, you know, we don't need to be afraid of and constantly put forward the fear of new variants when the vaccinations are working, when the results are clear after weeks of watching other jurisdictions? Why do we continually say that we have to be careful of a variant that hasn't done what we feared it would weeks ago?
I think one can say that that's due to the diligence and the hard work that's being done by our frontline healthcare workers and our public health units across the province, because we're doing a very good job at, first of all, with the vaccination rollout, but also with case and contact management, with identifying these strains and being able to isolate them. We have seen breakouts in several parts of the province, in Porcupine, in Waterloo, and most recently in Grey Bruce. So we're not entirely in the clear yet. We still need to continue with both our first and second doses of the vaccine, and that's why we're continuing with our rollout. We are going to where people are, using whatever strategies we can to ensure that everyone who wants to receive the vaccine can do so.
Next question, and this will be our final reporter.
Last question from Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Minister. Or Minister Jones, perhaps. Just wondering, in the briefing we had earlier, they were talking about ramping away from mass vaccination clinics. So I was just looking to get a bit more detail on that front. What can people expect in terms of timelines on that when we won't see maybe hospitals having big clinics or things of that nature?
Yeah, it's a great question, because the mass vaccination clinics, while they have been very successful and a great model to get as many people as possible quickly vaccinated, we do have to acknowledge that hospitals also have a lot of other business that they need to be focused on. And as we return to that system, we're going to be able to get hospitals out of the vaccine business, so to speak, and put it where it historically and traditionally is, which is with the public health units, with our pharmacy and primary care practitioners. When you think of other vaccines that are annually administered in Ontario, those are the three primary pathways, and we'll move to that as we find our need for the mass vaccination clinics decreases, because we have the number of people that want and have received their vaccine have got them. And I want to reiterate, hospitals were not in the vaccine business, and my goodness, have they stepped up and been such an amazing partner to make sure that when we had the vaccines, we were able to get it into people's arms very quickly. So I really want to give a shout out to all the hospital partners who were able to organize those on-site mass vaccination clinics. They really made a difference in order to speed up the delivery of the vaccine rollout.
Follow up?
And I'm just wondering, in terms of this mass vaccinations, we're still waiting for vaccines to be approved for kids under 12. So where do you envision those kids being done if there aren't mass vax clinics anymore? Would they be done at their school, perhaps? Or where else would they be other than doctors' offices?
So again, there are a number of pathways for other vaccines that we have in Ontario, and we will return to that if and when Health Canada gives approval for children under the age of 12. So school-based clinics is one possibility hosted by public health units, but of course pharmacy and primary care practitioners have always played a really critical role in educating, informing, and ultimately administering vaccines in Ontario.
Thank you.